I'm Dr. Ryan Harden, faculty member from the Department of Family Medicine and Biobehavioral Health at the University of Minnesota Medical School, Duluth campus, and family medicine physician at Gateway Family Health Clinic in Moose Lake. I am your host for our episode tonight on common upper and lower gastrointestinal conditions. The success of this program is very dependent on you, the viewer, so please call in your questions or send them in email to ask@pbsnorth.org. Our panelists this evening include Dr. John Reich, a board-certified physician with Essentia Health in Duluth, where he provides specialized care for gastrointestinal and digestive conditions, Dr. Sandy Stover, a physician and faculty member with the University of Minnesota Medical School in Duluth, where she combines patient care with medical education and training, and Dr. Stacy Gutman, a board-certified general surgeon with Community Memorial Hospital in Cloquet, where she provides a full range of surgical care for the region. Our phone volunteers tonight are Blake Bartnick from Cambridge, Minnesota, Ava Hill from Aurora, Minnesota, and Ian DeRalph from Duluth, Minnesota. They are standing by to answer your calls. And now on to tonight's program on common upper and lower gastrointestinal conditions. Well, welcome everybody. I've been excited to have tonight's show because we're fortunate enough to have a surgeon, primary care physician, and a gastroenterologist to field these questions. I don't think there's a question that we're not going to be able to answer collectively. So welcome and thanks for being here.
It's good to be here.
Thank you.
I've been collecting a couple questions from my patients over the past couple weeks in anticipation of the show, and I think we're going to get some more questions from our callers. But while we wait for those questions, I wanted to start with a common question that I'm asked in the clinic. This is from a patient in Sandstone. Dr. Reich, is Cologuard better than a colonoscopy?
I think the short answer is that colonoscopy is what we consider the gold standard for diagnosing and even preventing colon cancer. And so the short answer is no. However, it's a timely question asking about colon cancer screening because it's been mediaized that the incidence or the rates of colon cancer, particularly in younger people, have been going up, and even just in the news in the last couple of days, TV and movie star died from colon cancer at a young age, at age 47. And so there are multiple modalities for screening, and you don't have to have a colonoscopy, at least initially, to be screened if you don't have any other higher risks, such as first-degree relatives with colon cancer symptoms, things like that. And so I would say colonoscopy, while it is the gold standard because we can find and remove precancerous lesions during it, it's not the only way to screen for colon cancer. And so it's just very important to get screened. And so Cologuard, for that reason, it's not a perfect test, and none are, but I would say it's better than not doing anything.
Wonderful. And in addition to Cologuard and colonoscopy, there's even more ways to screen for colon cancer. So just important that everybody gets screened.
Yep.
Wonderful, thank you. Dr. Stover, this is a question I get in my practice a lot. Patients will end up having an imaging study for another reason and find out they have fatty liver. So if you could explain what fatty liver is and how we manage that.
So fatty liver is actually not completely understood, but in terms of the different variations it can kind of present as. But the liver itself naturally has some fat in it. In terms of what happens in the metabolism of the body with relative to things we take in, the food we eat, the alcohol that may be something that we drink, that can change the proportion of active functional cells and this fatty cells. And so the more fatty cells, are kind of lazy, sitting around doing nothing cells, can impact the ability for your liver to do its job. And its job is to detoxify you from things you eat or side effects of metabolism within your body or medications you may have taken, and help process those. So the way to manage it, and I'll also look to you on this one too, but the way to manage it is to be as healthy as you can be in what you eat, how much you exercise, what your overall kind of body mass index is. Kind of a funny thing we measure looking at height to weight ratios, but it's a way of kind of looking at are we at an optimal place for our height. Weight itself is kind of funny. I have had patients who have been upset by maybe a higher weight, but then you look at them and they're 6'2". So you have to think about the whole package really.
But fatty liver is something that's quite common, isn't it?
Yeah.
Wonderful.
But it's across a continuum from something that you notice that's without symptoms and unlikely to cause significant harm to significant changes that can impact the ability for day-to-day processing of those toxins.
All right, thank you. Dr. Gutman, this is a common question I get in the clinic. When I had my colonoscopy, I was found to have diverticuli. What is that?
So I always explain diverticuli to be these little pockets or holes in your colon wall. So the colon ideally is sort of one long smooth tube where your waste product can move through easily over time, or some people seem to be more prone to it, or more stress on the colon wall and those muscles, is that it can actually form these little pockets. That it's almost kind of like a hole at the golf course in the side of it. And so then things aren't going to move through as smoothly, and then also stool and other things can get stuck in the side. It's not uncommon to see diverticuli on a patient. Now there's a difference when you tell someone, hey, you had diverticulosis on your colonoscopy or on a CAT scan, versus you are in the hospital or you're home with diverticulitis. And so I think that's a really important distinction to make, because a lot of people, when you say you have diverticuli, immediately go to the, oh, well, I had a friend in the hospital with really bad pain on the left side of his abdomen. And so I think knowing that you have it just gives you sort of the power to say, okay, and again, it goes back to diet, like you're talking about. One of the most important things to sort of decrease your risk of having issues with it would be to eat more fiber. A true high fiber diet and staying well hydrated can help your stool be kind of this happy, bulky medium to be able to pass through a little more easily and less likely to cause complications from it.
So diverticulosis, or having diverticuli, can be something that's asymptomatic.
Definitely.
Okay.
And the other side of having diverticuli also can make you higher risk for getting a bleed from those. So those are kind of the two ways that the diverticuli could cause problems. Inflammation, which would be the itis part of it, versus having kind of bleeding from the diverticuli, because where those holes are, your colon wall is thinner, and you can get bleeding from that too. So, but I think having it just gives you the power to sort of know this is something that I have, versus it's not something that you need to wake up every day going, oh my gosh, I have diverticulosis. What am I going to do now? So.
Well, excellent. Thank you for that answer. Oh, Dr. Reich, this is a very, very common question that I get in clinic, probably because it's a common symptom. But what is acid reflux, and how do you treat it?
Yep, so acid reflux is one of the most common symptoms in the entire GI tract. And there's not one sort of specific way that people can feel it. In fact, many people have what we call silent reflux, meaning it's occurring and they don't notice it. But essentially, so the stomach makes acid. Acid is important to start the digestive process. And in some people, where their esophagus, the swallowing tube, where food goes from your mouth down to your stomach and where your stomach meet one another, there's a sphincter muscle that for various reasons can sometimes relax too frequently, or people can get an alteration in their anatomy a bit where the top of the stomach slides upwards a bit, called a hiatal hernia. And when that occurs, that sphincter muscle just doesn't hang quite as tight as it's supposed to, and so the acid can a bit more freely kind of move up in the improper direction. And people have various symptoms from that, like I said, but the most common one is sort of a burning sort of discomfort in that sort of upper abdomen, lower chest area. And that symptom isn't always acid reflux, but particularly, let's say, after meals or when you lay down at night, those are some of the times where we say, well, yeah, probably that is acid reflux. And in and of itself, there are some potential, consequences of chronic reflux. But the way to treat reflux, often, there are certainly lots of medicines over the counter to take acid levels down. Some of them, one's called famotidine or Pepcid, is sort of on the spot, acts fairly quickly, takes the acid levels down, or Tums as well is a quick acting one that can help with symptoms relatively quickly. If this is a daily occurrence and it's very bothersome for you, maybe you want to see one of us, but also there's some stronger, more potent acid-reducing medicines like Omeprazole, and some others are called PPIs. I do like to talk about lifestyle with people too. And so things like weight loss, if someone is carrying a few extra pounds, particularly around the midsection, can help decrease the pressure on the stomach and less reflux. We'll have people try not eat before they go to bed, sometimes even put some 2x4s or 2x6s on the floor under their bedposts to raise their bed so that their head's a little elevated so that gravity can keep acid down. Things like caffeine, spicy foods, alcohol can increase the acid reflux symptoms. So it's a bit of a loaded question, but it's a very, very common symptoms, and there are multiple symptoms, and it's multiple ways to approach it.
So coffee can make heartburn worse.
And so I love my coffee. And in fact, I don't believe that coffee is harmful. There's been multiple studies say it's actually good for fatty liver, and somewhat maybe protective of alcohol liver damage. Not that you should chase your alcohol with coffee, but it may actually be a strong antioxidant and may be good for you. But it can cause increased burning and can cause that sphincter muscle sometimes to relax more frequently. And so it's just something that if it's a trigger for people, we say, well, maybe put a little cream in, or maybe you just have to avoid the coffee.
Well, I really appreciate that you said you like coffee, because I do too. So. Dr. Stover, a caller from the iron range is wondering, are prebiotics and probiotics beneficial for my gut health?
And that's a good question, and it's a big subject. There's a lot of things we don't know about the balance of what's normal for any human, let alone an individual human, and all the other things that we do. But I think it's helpful to remember that the biome, or the kind of the collection of bacteria that we have in our bowel, helps us with our immune system. Our gut is one of the places where we encounter bacteria, and it's figured out how to manage that, and it's the normal bacteria for that area. It helps in digesting and also absorbing a lot of the things that we eat. So prebiotics is a little bit of a newer kind of a term, and it's something to kind of help support the biome. Probiotics are a little bit more of encapsulated combinations of different bacteria. I think there are times when, particularly after someone's had a stripping of their bacteria from being ill for a while, or having a sequence of maybe several times where they had to get colonoscopies or something that stripped it, or on antibiotics for a prolonged time. And it can be very helpful to nudge your bowels towards a more active flora. There are some good resources online that can kind of help with some of the differences out there. I think my best advice is, if people want to have the most active kind of support, it's refrigerated kinds, and most pharmacies and food co-ops often carry it too. You want to actually ask, and if it's not obvious where it is by the dried products, is ask for the refrigerated ones and what they have. But it's in the billions of sometimes of units, and it's because the acidity in the stomach is pretty high. And I always think about it as sort of, it's almost like a torpedo of probiotics going through, and kind of acids eating away at it. But by the time it gets into the colon itself, you still got at least a billion left to.
But something people can get over the counter.
Over the counter, it is not something that you should have to take every day. A good diet, a good broad, healthy foods, good balance of food, and if there's nothing that's interrupted it, if you haven't gotten significantly and prolonged illness that affected your GI system, you're probably doing fine with just a good diet.
Wonderful. Dr. Gutman, a caller from Duluth is wondering, after a bowel movement, what keeps you from feeling like you got it all out?
So what, do you think that they're asking why they still feel like there's something retained there?
Maybe after they have a bowel movement, they feel like they still need to
go. Yeah. Right. The anal opening and the muscles down there are potentially smarter than our actual brains, right? There's nothing else kind of out there that can sense, solid, liquid, or gas like our anus can. And so potentially it could be that they may have some, kind of something slightly different going on there, whether they might have some internal hemorrhoids or something that's sort of triggering that area to say, hey, maybe there's still something there. Now patients that have may have issues with constipation or have to strain a lot are more prone to get things like internal hemorrhoids, and the kind of pressure difference that having something there will make them still feel like they have that. There are other issues there are plenty of other things, rectal prolapse, other things that are just going to make the muscles down there not quite feel like it's empty. And so being aware of that, again, kind of going back, the best way to kind of improve that is going to be, again, a good high fiber diet, staying well hydrated, preventing having to strain, and not only straining from the sense of trying to get the bowel movement out, but also prolonged sitting on the toilet is a thing that I think we're seeing more of, especially with more people having their phones with them while they're going to the bathroom. And so you're not just flipping through a magazine, but now you can continue to scroll. And so that whatever's increasing the pressure down there could make those issues worse. But if you're feeling something down there, I think it's worthwhile to get it checked out, because maybe it is hemorrhoids or something like that, but there is always, if you aren't up to your screening or haven't been checked out for polyps or other scarier things, then I think that it's worthwhile to be evaluated for.
Yeah, and that's what I was going to say. I mean, great answer.
Yeah.
But something that should be checked out by a physician, probably.
Yes. Yeah.
Okay, wonderful. Thank you. Dr. Reich, another common question in the clinic that I get is lactose intolerance in children. What are the symptoms and how do we manage that?
Sure. And so lactose intolerance is an interesting topic as well. And essentially there's an enzyme in our small intestine, it's called lactase, and it basically helps us break the lactose down into its simple sugars. And if we're unable to break it down, then that lactose doesn't get metabolized, and it can get to the colon, can cause a lot of gas and bloat and diarrhea, and just sort of generally sometimes feeling unwell. Now, there's a lot of questions too that we get about developing lactose intolerance in older age too, because actually many adults lose that enzyme as we get older, and so people can get lactose intolerance as we age. There's also a lot of people who aren't necessarily intolerant to lactose, but who are intolerant to some of the other proteins in dairy products, particularly milk and ice cream are probably the largest offenders, maybe less so cheese and butter, but that where you can get more of kind of an irritable digestive system from milk or ice cream, dairy products. That's not necessarily lactose intolerance. But so it's, and if Dr. Stover wanted to comment on sort of what she sees maybe in the pediatric population with that, I just don't see as many kids, but it can be a genetically a lack of a proper enzyme to break lactose down.
Well, and it's complicated in babies because ideally breast milk is the best food because it's sort of built and developed by humanity to be a good absorption form of nutrition. But kids can run into problems, and sometimes it's too much volume. They get excited. They're using a bottle to get it out, obviously, and they'll drink a lot, and that can cause some of it to come back up again. Their esophagus is kind of wimpy relative to an adult esophagus, where it comes into the stomach, so it can come back up again. I think it depends on fat content. It's possible that kids have an intolerance, but it's not a true allergy. That's actually relatively rare with milk, but that it's the combination of is their body capable of handling the level of the fat, the calcium, some of the lactose and things like that in the milk. I think it's important if a baby is continuously throwing up from any kind of food, that definitely is a red flag again to go get checked out. There's some different kinds of things in baby's anatomy that can impact that. It's a great calcium source though, whether it's breast milk or later as kids graduate from breast milk and go into cow's milk or other kinds of goat milk, those kinds of things. It's a great source of calcium, and so it's something to talk about with a pediatrician or a family doc if kids are having trouble just for the nutrition and for avoiding some of the potential for that they're irritating their immune system by reintroducing an irritant.
So they're not just little adults, kids.
They are not.
Well, great answer. Dr. Gutman, I took these questions out of order because this is a surgical question, I think. A caller from West Duluth is wondering, do I need to have surgery for my hemorrhoids?
Oh, That is a good question. So I don't see that. I mean, that's a pretty frequent thing that people get referred to me for. And I think the short answer is, well, it kind of depends on what kind of hemorrhoids you have. There are ways to treat and manage certain hemorrhoids, and there are kind of two categories. There are what we call internal hemorrhoids that I was talking about before, but they are going to be inside, and then the external hemorrhoids that can kind of come out on the outside. The internal hemorrhoids can actually come out too, though, so it's a little bit of a fine line, but it's based on where they are. The internal hemorrhoids, sometimes those can be managed a little bit less aggressively, and you can have a procedure that's called banding, or there are other modalities out there too to get rid of them. The ones that are more stuck out all of the time, sometimes those do require surgery. I would say that a lot of it is very patient dependent. So if you are really bothered by your hemorrhoids, they're getting in the way of hygiene a lot, or they're causing you discomfort frequently, you're getting a lot of pain from them or discomfort, then those are reasons to take care of it. Some people, we push more of doing kind of banding for internal ones on people who are having bleeding from them. Again, though, if you're having any kind of bleeding, that's definitely something that you need to go and see your doctor for to make sure. Because if it's hemorrhoids, that's one thing, but if there's other causes that could be causing bleeding too. And again, I would put more money on more fiber, more water.
Yeah, I really appreciate that answer, but the punchline is anytime you have rectal bleeding, it needs to be checked out by a physician.
Yep.
Okay, great, thank you. Dr. Reich, this is a GI question, definitely. Are esophageal spasms common, and how do we treat them?
So esophageal spasms are, I would say the answer that I have is I'm a bit biased because I see it relatively frequently. However, just in the general community, they're probably not particularly common. And essentially, esophageal spasms present as usually sort of a chest pain that sometimes can double people over, and sometimes, many times, mistaken for a heart attack. Now, I will say if you're having chest pain symptoms, you need to be evaluated for your heart. But there are multiple reasons why it may happen. Acid reflux can irritate the esophagus, and the esophagus is essentially just a long muscular tube, and it pushes food down when you swallow. But sometimes it can all tighten up, like you're flexing your bicep muscles or something, but it's on the inside and it can be quite painful. And so often, if we think that that's what someone's having, their heart seems fine, everything else, we'll try to reduce acid levels, see if that helps. And sometimes we will use some versions of muscle relaxers that actually sometimes are used as heart medicines. One's called diltiazem, another one also isosorbide, some other things to try to just settle those down. So it's relatively common and it's benign, but it can be disabling for people. And so it's something that, if you're having those symptoms, come and see us in the clinic and we can talk through some of the options.
Wonderful, thank you.
Yeah.
Dr. Stover, common question that I get, can stress cause ulcers?
That is a good question. Stress is one of those things that our body has a reaction to, and one of that reaction is to produce more acid in the stomach in response to stress. If you think of the acid against that stomach lining, it's hydrochloric acid, which will etch glass. I mean, it's strong acid, and our body is built with cells in that lining that turn over very quickly so that they stay healthy and can help in absorption and in motion to kind of help the food move around. And so if the acid is higher than the body is built to protect itself, you'll get burns. And if that's compounded by taking anti-inflammatory medications like ibuprofen or aspirin, that those are acidic enough to create their own little burn marks, kind of, or sizzle marks in the lining of the stomach. And so stress often gives you a headache, which makes you take ibuprofen, and then if you're having a cup of coffee, which is acidic, or a glass of alcohol, which is a solvent that can reduce some of the mucus in the lining, those can all compound the problem of a bad stomach.
Wonderful, thank you. Dr. Gutman, I apologize for this. We have less than a minute, but A surgical question. I have gallstones. Do I need surgery?
So probably about 30% of people have gallstones if we imaged everyone. If you are having symptoms, so the most common textbook answer would be if you have pain on the right side of your upper abdomen that seems to happen 20 or 30 minutes after you eat a piece of pizza or something fatty or greasy, then you could be having problems from gallstones. If you just found them randomly on an image test and weren't having any symptoms from them, you don't need them today. To get it out would be the short answer.
All right, wonderful. One quick question. We just have a couple seconds left. Is omeprazole, I'll put this out to everybody, is omeprazole bad for us?
It depends. There's pros and cons. It can reduce the ability to absorb things like calcium, which we need for bones, but it also helps, as you were talking about earlier, in reducing acid and protecting the lining.
Yeah,
so
it's made so many fewer people need to have surgery for bleeding ulcers or perforated ulcers. So. Yeah. Always talk to your doctor, but overall.
Talk to your doctor.
Take a multivitamin if you were going to be on it for extended periods of time.
There you go.
Yeah.
Well, I want to thank our panelists, Dr. Stacy Gutman, Dr. Sandy Stover, and Dr. John Reich. Please join Doctors on Call next week, where Dr. Mary Owen will be joined by regional experts for a panel discussion about caring for patients with serious illness and end-of-life concerns, with a panel of experts from around the region. And if you're looking for more tips, tricks, and conversation around health and wellness in the Northland, make sure to check out Northern Balance on PBS North YouTube channel. Thank you for watching and for joining us for season 44 of Doctors on Call. Good night.